Hundreds of thousands of Utahns have already received at least one dose of the COVID vaccine. Tonight, still hundreds of thousands more may be waiting for their appointment day to arrive. It's a relatively easy process. Show up at the designated time and location to receive your shot. Show your ID, answer a few questions, roll up your sleeve, get your shot, and then you're off, maybe not knowing what you're leaving behind and where it's going.
Small poke.
At mass vaccination sites like this one at the Mountain America Expo Center in Sandy, run by the Salt Lake County Health Department.
Not too bad, right?
Yeah, that was fantastic.
Utahns 16 years and older are here for a shot in the arm.
I think it's important to be vaccinated.
And proof of their COVID-19 vaccination.
Then they have this card to take home with them.
This piece of paper, small enough to fold and fit in a wallet,
That comes from the CDC.
is written proof of the vaccine you receive. On it, the manufacturer, vaccine lot number, date, and the immunization provider stamped on the front. That personal health data, however, isn't only being recorded on the record card.
Thank you.
Thank you so much.
It's being sent and saved to a Utah State health management system where it will live forever.
All of the data gets uploaded to Utah State Immunization Information System. USIS is the acronym for it.
The website refers to the system as secure and confidential that helps healthcare providers, schools, child care centers, and Utah residents maintain consolidated immunization histories.
We treat it as a medical record.
Leishery Booth, a nursing supervisor with the Salt Lake County Health Department, has seen tens of thousands of patients come through COVID vaccination centers and says this latest shot will be added to likely an already lengthy history of vaccines you've received in the past that are already in the USIS system.
All of the childhood immunizations, all vaccinations that are given.
Health departments, medical groups, and doctors who provide the COVID-19 vaccination are required by state mandate to submit patient and vaccine data to the Utah State Immunization Information System. Non-COVID inoculations can be submitted on a voluntary participation basis by the provider. The information is used and shared on a clinical level to determine patients' vaccination needs. That data, in turn, helps guide public health action and evaluation on potential risks to Utahns with the goals of improving vaccination rates and reducing vaccine-preventable diseases.
That was it.
That's it.
And since this is confidential medical information, it's protected.
We treat it just like any other HIPAA information.
But accessible when needed or misplaced.
That card can easily be lost, but yeah, it's easily recoverable as well.
Patients are able to use the USIS system when a copy of their vaccinations are needed, whether it be for school admitting, the transfer of doctor or medical records, and any other situation the pandemic could bring on.
Because who knows which businesses or airplanes or who knows in the future that might require, to show proof of vaccination.
And while proof is one thing to carry and maintain on a personal level, if knowing your personal and medical data is being sent to a state-run database feels like a shot in the gut,
These are the empty ones.
you can request to opt out of the system by filling out this form on the Utah Department of Health immunization webpage. Once filled out, your records will be removed and future vaccine info will not be uploaded, whether it's COVID dose 1 or 2, and potentially additional doses to come.
That's a good question. We're all waiting to hear, data that hopefully will come out and say, how long will this vaccine last? Is it going to be a yearly vaccine? Don't know yet.
Time will tell on that one. Alicia Ree, who you did see there in the story, did point out to me the CDC provided vaccine record card does have 2 additional lines for vaccine info that are labeled other. Maybe an indication that your COVID vaccine history will grow. However, as of tonight, there are no recommendations for additional vaccines past the single-dose Johnson & Johnson shot and 2-dose Pfizer and Moderna vaccine. In studio, Kelly Chapman, Fox 13 News, Utah.